Hi, I'm Dr. Sarah Lavender, and I'll be your physician today. My nurse tells me that you had quite a nasty bump on the head that you're in recovery for. How are you feeling today? Okay. Your chart here says the bump was there. Yeah, I can see it. Well, before we begin, can I just confirm your full name and your birth date? Great. So what you're here for today is what's known as a cranial nerve exam. They're pretty common when a patient has a head injury, and it's just to make sure that all the nerves in your face are speaking to the brain as they should be. So it's a test of all of your senses. Yeah, no, it'll be pretty thorough since you did have a head injury, but it will be painless. Great, so let me just add a few more things to my chart. Are you currently on any medication? And do you have hearing aids? Or glasses? Yeah, if you have glasses, you'll want to keep them on for this exam. Perfect. So you're not currently in any pain from the head injury, right? Excellent. It does look like it's healing quite nicely. My nurse got all of your vitals, and you're looking good there. So I think we're ready to start. Do you have any questions for me? Yeah, if this is your first time getting a cranial nerve exam, I can definitely walk you through every step of the way so you know exactly what's coming. Perfect. Yeah, I can do that. Let's get started. So I have some gloves I'm going to be putting on. So how did you injure your head? Oh, ow. Well, I can definitely take a closer look here in a second. Before I touch you, I just want to gain consent. This exam is up close, and I want to make sure that you are comfortable with that. Great. Okay, so let's see here. It does seem to be healing quite nicely. Yeah? Maybe a week or two until it's fully healed. Great. Alright, so the first part of the exam, I'm just going to be getting a general assessment of your face and your head, making sure the symmetry looks good, no obvious signs of swelling. No tremors. You look good. Well, the official first nerve we're going to be testing is your olfactory nerve. And what that is your sense of smell. So this test is quite easy. It's kind of fun. I have essential oils here, and I'm going to ask you to tell me what they smell like. So before we begin, I'm going to just take a look inside of your nose. A new piece here. Other nostril. Looks great. And your nose isn't stuffy today or anything. That can sometimes impair smell. Perfect. Okay. Well, let's start with the first smell. Can you plug one nostril, please? Okay. That's correct. Lemon. Very good. And then the next. Oh, sorry. Please plug the other nose, the other nostril now. Yes. Coffee. Well done. Are you a coffee drinker? Yeah, I am, definitely. So your olfactory nerve is completely functioning. Next, we're going to test your optic nerve, which is your eyes. So all these nerves can have either a motor or a sensory component. Some of them have both. And the optic nerve has to do pretty specifically with vision, not so much eye movement, which is the next nerve set. So I'm going to be taking a look at your pupils, checking for size and symmetry, any abnormalities. I'm going to get quite close and be using a bright light. So let me know if at any point you're uncomfortable. That eye looks good. Alright, that eye looks great. Very nice. Next is something called the swinging light test, where I'll be moving from pupil to pupil and making sure that when the light is in this pupil is also constricting in equal size. So, great. Wonderful. All normal there. So your pupillary reflexes are great. Next we're going to test your accommodation reflex. So stay still. Can you please focus on my thumb and then focus on my face and then back to my thumb when I say. Ready? So my thumb, now my face, and then back to my thumb. Wonderful. That's just making sure that your accommodation reflex is working properly, which it is. So this is optional, but we're going to perform a fundoscopy, which is looking at the very back of your eye, and it's a different light. It's a bit bigger, and I will be looking through. Alright? I'm going to raise your eyelid on this eye and then slowly approach with this light. in the other eye. Beautiful. Perfectly normal. The next test is for your visual fields, which is your periphery, the field in which you can see. And how we test that is just go ahead and cover one eye and tell me if any part of my face is blurry. Alright, and then the other. No blurriness? Excellent. Next, stare at my face and tell me when my finger is out of your vision. Perfect. Perfect. Excellent. Now I'm going to stand back and hold up either one or two fingers on either side. And can you tell me whether I'm holding one or two fingers and on which side? Ready? Perfect. Your visual field is completely healthy and normal. Next is visual acuity, and this is the most common eye test that you've probably experienced. We'll be using a Snellen chart, which is this famous chart. So with both eyes, can you tell me what the smallest row of letters you can read is? Great. Now please cover one eye and tell me what that row of letters is. Alright, and then the other. And please read this row backwards. Wonderful. No changes in your vision according to my chart, which is excellent. So your optic nerve is completely normal. So next we're going to be testing a group of nerves which transmits motor information back to your brain from your eyes, and it's what moves your eye and your eyelid. So these three nerves are normally tested together because they're so related, and it's your ocular motor, your abducens, and your trochlear. So let's begin with you staring at my finger, and this time your eyes are allowed to move. It is a motor nerve. And just follow my finger. Beautiful. Very smooth movement. Looks healthy. So next, as part of this nerve group, we're going to be testing your Cycads, which are high velocity eye movements designed for search. So it's the quick eye movements. And there are two kinds. And the first is your reflexive Cycads. So I'm going to stand back once again. And I'm going to wiggle, maybe even a little further back. Wiggle one of my hands. Please stare at my face, and when you see a hand wiggle, look with just your eyes to that hand, okay? And then back to my face. Great, and then again, but here. Beautiful. And then for your volitional Cycads, can you stare at me and then look all the way this way? And then all the way this way. All the way up. And then for looking down, I'm going to hold your eyelids up, and please look all the way down. Wonderful. Everything looks completely healthy. The next nerve is your trigeminal nerve, which transmits motor information from the mandibular, so chewing, and also sensory information from physical touch sensation on the skin. So, you might have guessed how we're going to test the sensation, so we're going to poke you. So first we test very light sensations, and we'll be using this cotton ball, and I'll be touching it to 3 major areas of your face: your ophthalmic, maxillary, and mandibular. So you felt equal sensation on both sides, correct? This side? Okay, so the side near the wound had a little less sensation. Let me just... Okay, I will make a note of that. Let's proceed on to the pinprick test, which is a sharper point. It's just a toothpick. Some people use safety pins. I think that's a little too sharp, so we have just a toothpick. I'll be doing the same thing. 1 prick there. 1 prick there. Okay, so a little less sensation there. What about here? And here. The same. Here. And here. The same. Alright, so we're going to want to map out the exact area where you're feeling a little bit of sensation loss. Let me grab my clipboard. Alright, so but there was no pain, correct? Just a slight lack of sensation. Alright, so I'm going to start from where you feel normal sensation and work my way up. There, a little less, okay. So let's come over here and poke here. Even more so, less, okay. Alright, I'm going to poke near the top. There. Alright, I will make a note of that. It's not that unusual, especially after an injury, but we are going to want to keep an eye on it. Thanks for being honest with me. I know sometimes people or patients tend to go through these kind of exams not answering honestly just because they don't want there to be something wrong, so they just say it's fine to every answer, but it's important you answer truthfully. So now we'll be testing the motor function of this nerve, which is the muscle you use for chewing. So I'm going to feel right here. Can you clench your teeth real strong for me? Again. Again. Alright. So I'm going to put my hand under your chin. Can you open your mouth and not let me close it? Great. Everything looks perfectly normal. And the next nerve is just your facial nerve, which is the muscles that you use to control all of your expressions. So let me just look for hollowing, any issues, any cavities in any muscles. Great. So, can you smile real big for me? Alright, and then puff out your cheeks. And then raise your eyebrows and wrinkle your forehead. And then make a kissy face. Great. All your facial muscles seem to be working well. There's no sign of one side having less function. Excellent. Next is your vestibular cochlear. Vestibulo cochlear. That's a tongue twister, isn't it? Which is your hearing, which is directly related to your balance. So there's two components to this. But first, we're just going to test your hearing. So I have quite a funny test for you. I'm going to go behind you and then touch this part of your ear, which should be pretty loud. Let me show you. Kind of loud, right? And then I'm going to whisper 3 words in this ear and just need you to repeat them back to me. And then I'm going to go to the other ear. At any point, if you can't hear me, I will move a little closer and whisper. So, once again, I will be behind you for this. So, all good? Okay, so I will be rubbing this here. Hello. Goodbye. Purple. Yellow. Wonderful. Now the next ear. Doctor. Student. Toothbrush. Okay, it seems like your hearing is perfectly normal. Wonderful. And now I'm going to use a tuning fork, which is a little strange at first, but maybe you've seen one in a doctor's office before. And it is this device. So I'm going to hit it, and it makes a very quiet ringing noise. So for the first test, I'm going to place it directly on your forehead, and I just want to make sure you hear it equally in both ears. And then the next test, I will place it right on the bone behind your ear. And how that test works is, well, you'll see. So here we go. You heard it equally on both sides? Great. So then, I'm going to place it here, and then you tell me when you don't hear it anymore, okay? No? How about now? Yeah, so when you move it closer to the ear, off of the bone, usually a patient can still hear it, which you do. And that's because your ears hear better through the air than through the bone. So, excellent. So the second component of this nerve is your sense of balance. And normally how we test this is I shoot your head back really quick, or I lean you down really quickly. But because of your head injury, I think we're going to skip that, as long as you haven't experienced any vertigo since your head injury, or any time, any change. Okay, so then we can go ahead and move on to the next set of nerves, which is your glossopharyngeal and vagus nerves. And these nerves convey information about taste. They affect your gag reflex, things like that. Have you noticed any change to your taste recently? Okay, all good. Well then, I have a clean device here, which I will use to lower your tongue, and then look in the back of your throat. Okay. Can you say ah for me? Wonderful. I could test your gag reflex by touching the back of your throat, but that's not always necessary. It's quite uncomfortable for some patients, so as long as you haven't noticed any symptoms, we can go ahead and skip that. And the last part of this, can you tell me what brings you to the doctor today? Yes, I know we kind of discussed it, but just humor me. Yep, okay, so I was just listening to your articulation. Everything looks normal. Articulation is normal. Those nerves do affect the speech in everybody. Second to last is your accessory nerve, which is the nerves in your neck that control motor movement. Once again, no issues. Okay, so then I'm going to have you turn your head and then resist my push, okay? And then push against it. Excellent. And then turn the other side. Resist. And then push against it. Alright, healthy. I felt a healthy resistance there. And then I'm going to put my hands on your shoulders. And I want you to shrug up against them, okay? Perfect. Your accessory nerve is completely normal. Last is your hypoglossal nerve, which is your tongue and the motor movement of your tongue. So, will you stick your tongue out for me and move it side to side? Excellent. I know it's silly. And then push your tongue against your cheek. And then I'm going to press it. And you try to resist the push, okay? Other side. Wonderful. So I think you are healing very well. You'll get the results of this cranial nerve exam through our online portal. Do you have any last concerns? Yeah, let me write that down. No, in my opinion, you're healing completely normal, no major areas of concern, though I will follow up with you on the lack of sensation near the wound. Alright, well, thank you so much for being an excellent patient today. Don't hesitate to contact me or my nurse or my office if you have any concerns. And like I said, we'll have the results in 2 to 3 days. Great. Well, until next time.